Hi guys, I'm Savani, a third-year biology undergraduate student with a minor in entrepreneurship, and this is Lucas, a fourth-year biochemistry major. Partnering with the Health Catalyst program, this project aims to develop a machine learning-based model by integrating existing data into EMR systems to help predict post-stroke spasticity risk. We are hoping this provides actionable insights to healthcare professionals and serves as preventative care. As our team is in the beginning stages of the prototyping process, this team required efforts in reviewing primary literature, shaping strategies, and aligning their efforts with clinical goals. Our role as undergraduate researchers, passionate in the intersection between healthcare and AI, was to help be that bridge between the science and commercial viability. And we did this through advising with a pitch deck for funding and bringing knowledge on implementation and the path to market. And we were honored to work with many mentors such as Patrick, Darshini, and Corey and Ben for valuable insights to help us navigate through this prototyping process. So now I'd love to hand it off to Aaron, who can speak a little bit more about this. Thank you.
Hello, everyone. Thank you so much for being here. It's awesome to see so many people come out and support in community as we're working on hard problems. I'm going to jump right in now. So I'm going to tell you about how we're planning to model post-stroke spasticity for clinical decision support. So botulinum toxin A, or Botox, is the established standard in post-stroke spasticity management. In a randomized controlled trial, early treatment led to significant improvements in muscle tone, upper limb strength, basic arm function, and pain at 12 months. However, there's a problem, and that's up to 95% of patients with post-stroke spasticity are undertreated. So in the US, we have about 660,000 stroke survivors every year. It's estimated about 40% will develop this spasticity. We're diagnosing 1/4 of that. Beyond the diagnosis, we're treating 1/4 of those who are diagnosed. So the goal here is to predict PSS to achieve early intervention. We have an interdisciplinary team of expert ML researchers, and we're supported by a brilliant physician who has domain expertise, who's worked on these cases. So topological stroke volume is the best predictor of stroke severity, and we believe it's also potentially the best predictor of PSS. So our pipeline is to start with MRI or CT data. We perform segmentation using an ML model to identify the region of infarct or hemorrhage. We then map this to a brain atlas. We can identify the region, and all of this through ML, we can do feature extraction to pull out the affected regions and the volume per region. From this data, along with a rich data profile of the patient, we can generate a risk score to support early diagnosis. So based on patients who survive stroke and then have post-stroke spasticity, we're able to put together a collection of positive training samples and negative training samples. We train a model off of this, and we have a predictor of how confident the model is in PSS. So from this, we have our risk score. So this essentially allows us to have a direct risk assessment from standard of care data collection. So a patient arrives in the ED. The physician conducts standard of care, nothing additional, nothing different from what they normally are doing. We pull those features, pass them into our model to get a predicted risk score, and give that back to the physician so they can make the informed decision on how to best follow this patient. And then just in a roundup, again, 95% potentially are undertreated based on the literature. 75% have a late or undiagnosed case, and AI can help us improve patient care. And with that, I'll take questions.
So your technology is reliant on DICOM images and processing those. So my question is, who's your customer?
So, I mean, ultimately we build out a model. So we want to process the DICOM images immediately to create a training set to build our model out. So once we have this model in place, we can implement that with simple features that a physician could identify and input manually, or if needed, we have an additional cost to process those images. Secure file transfer to the server and return back the results.
So the hospital system that is seeing the patient for the first time.
Correct, right? We build out an EMR module that's in some sort of a shop space, for example, and a physician's or a hospital system is interested in using this, they could purchase a subscription service.
It looks like you've built your algorithm based on a training set. Have you had an opportunity to test it yet?
So we haven't. We're actually super early. We've just identified a plan. So we're still identifying potential data sets. We're also talking with our partners at Del Med to see if we can do prospective studies to recruit and do some sort of a clinical trial in the space. I'll be honest, I'm a machine learning expert. I'm not an FDA expert, so I don't know, but that is why we have the support and the team we put together. Thank you.